Guys, welcome back to my channel. This is going to be the last video in the Core Concept series for Med-Surg nursing. So as a reminder, this is a back to the basics series and where we really are just trying to understand what is happening inside the body so that we can better assess and care for clients with acute and chronic conditions. So this has been a great series if you're a fundamental student and you are just learning about these basic core concepts, but this is also a really nice series if you're a Med-Surg student, either basic or advanced, and you really need that nice refresher as you move into acute and chronic conditions. So again, this is, I think, the 18th video in the Core Concept series, and it is the last. And today we are going to be covering sexuality. Hey guys, welcome back to my channel. This is going to be the last video in the Core Concept series for Med-Surg nursing. So as a reminder, this is a back to the basics series and where we really are just trying to understand what is happening inside the body so that we can better assess and care for clients with acute and chronic conditions. So this has been a great series if you're a fundamental student and you are just learning about these basic core concepts, but this is also a really nice series if you're a Med-Surg student, either basic or advanced, and you really need that nice refresher as you move into acute and chronic conditions. So again, this is, I think, the 18th video in the Core Concept series, and it is the last. And today we are going to be covering sexuality. So sexuality is defined as a complex integration of physiologic, emotional, and social aspects of well-being related to intimacy, self-control, and role relationship. Now, sexuality involves the act of sex itself, and then, of course, sexual orientation. Now, sexuality is not the same as reproduction. We're not talking about reproduction. Reproduction is the process of conceiving and having a child. If you want to know more about reproduction, there are videos on my channel related to that. However, today we are just talking about sexuality. And the interrelated concept is comfort. Comfort we have already discussed on this channel. So if you missed that video or you would like to go back and refresh, I will have all of the Core Concepts videos linked in the description box below. Okay, so much like everything else we've talked about, sexuality does sit on a continuum. Now, a lot of patients are just right in the center of the sexuality continuum, although what we hope is that patients are much closer to the side of positive health and function, meaning they feel very positive about their sexuality and their sexual function. However, some patients are going to sit on the negative side where they are experiencing impairment or sexual dysfunction. Now, interestingly, men and women both define sexuality, sex, and sexual health very different. Women usually define sexuality as both a physical and emotional experience, and men tend to describe or associate sexuality with the physical act of sex itself. Now, risk factors. So risk factors for impaired sexuality. So women experiencing menopause will also experience vaginal atrophy, dryness, mood changes, decreases, which are caused by decreases in estrogen and progesterone. They can also experience decreased libido through all of that, which can impair sexuality. Men can experience erectile dysfunction or prostate problems that lead to sexual impairment or erectile dysfunction. Some medications, particularly antihypertensives, can cause erectile dysfunction. Chronic diseases such as diabetes mellitus, we know that we can experience microvascular changes to our central nervous system or to our nervous system because of diabetes mellitus, which can impair sexuality. And then for men in particular, decreased testosterone can affect libido, erection. Physiologic consequences. So impaired sexuality tends to result in a poor self-image and a poor self-concept. And then when we as nurses go to assess sexuality, it's important to remember that discussing sexuality is often difficult. We as nurses find it difficult, and our patients will often find it difficult as well. However, it is a very important health assessment that we should be exploring with our patients. So when we think about assessing for sexuality or assessing sexuality, we want to ask about perceptions. So ask that client, what is their perception of their sexual activity? Do they feel like it's functional, dysfunctional, pleasurable, non-pleasurable? And then what are their perceptions about intimacy, other intimacy behaviors besides the actual act of intercourse? We also want to inquire about the number of partners and then what protection is being used to prevent sexually transmitted infections infections, and for females, what protection is being used to prevent pregnancy. And remember, those are not always one and the same. There are many things that protect against pregnancy that do not protect against sexually transmitted infections. And then we also want to ask about problems with intercourse. Is it painful? Does a woman experience bleeding? What are the specific problems that you seem to be having during the actual act of intercourse? From a health promotion perspective, we want to be doing a sexually transmitted infection screening, or at least assessing for those risky behaviors that could lead to a sexually transmitted infection. And then other exams might determine causes for changes in sexuality. So, high blood pressure, screening. Interventions are really going to depend on the cause of the impairment. So for erectile dysfunction and sexually transmitted infections, those are usually treated with medications. So there are, of course, medications to eliminate bacterial sexually transmitted infections and to treat, although we can't completely eliminate them, but to treat viral sexually transmitted infections. And for erectile dysfunction, there are numerous medications on the market that help with that problem. Now, a lot of patients will experience an emotional or a psychological impairment related to sexuality. So especially if the client has a history of sexual abuse or intimate partner violence or something that some kind of traumatic experience, there may be a psychological component to sexuality impairment. And for that, we might need counseling or intense, behavioral or mental health treatment. Okay, guys, that's all I have for you today on the very basics of sexuality. If you have any questions, please don't hesitate to leave them in the box below, or you can certainly reach out to me via email, my Twitter, or my Instagram account. This is the end of the Core Concepts video series, but I have a new series coming out for you, and it is going to be a quick pathophysiology series. And our first quick patho, so my goal is patho in about 5 minutes. As nursing students, I know that we don't always have time to watch 30 or 45-minute videos. We might not have time to read 5 or 10 chapters in a book, but we might have time to watch a 5-minute video to try to understand pathophysiology of an acute or chronic condition. So the first video is going to be on asthma, and that video will be available for you tomorrow. So take a look at that and see if you're interested in joining me for the quick patho series, and I will see you tomorrow. Have a wonderful day.